Hello and welcome everyone to the one-liner series for the DHA Pharmacy exam. First unit is General Pharmacology and the first topic is bioavailability and factors affecting it. So bioavailability is an important topic and there are 25 one-liners in this short video. So you can go through this and try to learn and understand all these one-liners. So first of all, we will look what is bioavailability. Bioavailability is the fraction of an administered dose that reaches systemic circulation unchanged. Now, suppose 100 units of drug is administered to a patient and the amount of drug which reaches the systemic circulation unchanged is 70 units. 30 units is lost in between, so it is lost in some GI tract due to any variation in absorption and many other factors. So, what is bioavailability? This 70 units or 70% then we can say is the bioavailability. So, bioavailability of each and every drug is different. It's different, it differs on or it depends on many factors. Okay, there are patient related factors, drug related factors, environmental factors. There are multiple factors which are responsible for bioavailability of a particular drug. Now, intravenous, that is IV administration of drug has 100% bioavailability. So, a question can be asked that which route of drug administration has 100% bioavailability. So, IV route, that is intravenous route, has 100% bioavailability. Oral bioavailability is reduced by the first pass metabolism. So, when a drug is administered orally, it undergoes the first pass metabolism, and that first pass metabolism leads to decrease of bioavailability. Okay, so in orally administered drug, bioavailability is always less than 100%. It's not 100% because of the question can be framed in this way that why the bioavailability in orally administered drug is less, so it is due to first pass metabolism. First pass metabolism. Now, what is first pass metabolism? Where it occurs? It occurs mainly in the liver, and drug with extensive hepatic metabolism have lower bioavailability. So it is obvious, as we have read in previous statement, that first pass metabolism occurs in liver. So if extensive hepatic metabolism takes place, then that drug will have low oral bioavailability. Sublingual and buccal routes bypass first pass metabolism. So sublingual and buccal routes bypass first pass metabolism, so it increases the bioavailability. Okay, and rectal route partially avoids first pass metabolism, not completely, but partially it avoids first pass metabolism. So it also increases bioavailability of the drug. So now, what concept you are learned from these few lines that the path of administration, where first pass metabolism is less than the bioavailability of that drug is more. This is vice versa. Okay. Now, poor aqueous solubility decreases bioavailability. If the aqueous solubility of that particular drug is poor, that it decreases the bioavailability of that drug. And highly lipophilic drug generally shows better absorption. So, if the drug is highly lipophilic, it shows better absorption. Weak acids are better absorbed in acidic pH. So, weak acids are better absorbed in acidic pH, and weak bases are better absorbed in alkaline pH. So, weak acid better in acidic pH, weak base better absorbed in alkaline pH. Remember these facts. Next point, delayed gastric emptying reduces the rate of drug absorption. So, if the gastric emptying is delayed, it reduces the rate of drug absorption. Rapid gastric emptying increases the rate of absorption of orally administered drugs. So, the gastric emptying is fast, and the rate of absorption of orally administered drug is increased. Food. What about food? Food can either increase or it can decrease bioavailability depending on the drug. Some drugs are preferred with food because the bioavailability of that particular drug increases with food, and some drugs are preferred without food, that is empty stomach, because bioavailability differs in these cases. Drug formulation significantly affects the bioavailability. So formulation of a particular drug affects its bioavailability. Smaller particle size increases dissolution and bioavailability. So if the particle size of a particular drug is small, that it increases dissolution as well as bioavailability of that particular drug. Entry-coated tablets nowadays, which is very common. So entry-coated tablet, it delays absorption but protects drug from gastric acid. So the absorption is delayed, but The overall effect is good because it protects the drug from gastric acid. Enzyme induction reduces bioavailability of affected drugs, and enzyme inhibition increases bioavailability of affected drugs. What does this mean? Suppose this is drug and some enzyme is acting on it and it is uh, metabolizing into some other compound. Okay, so if enzyme induction means increase the availability or increase the function of that particular enzyme. So if enzyme induction is, let's see it with a different one. So if enzyme induction is happening here, means that function or availability of that enzyme is increasing, then that drug is breaking down into, converting into another compound. While in case of enzyme inhibition, if this enzyme is getting inhibited, then that particular compound formation becomes less and the drug uh, concentration increases and hence bioavailability of the affected drug increases. So this is the concept behind enzyme induction and enzyme inhibition. Now coming on to next line, poor intestinal blood flow reduces bioavailability. This is again important point. So usually in ICU or sick patient or especially patient in shock or patient in sepsis, what happens? The intestinal blood flow. The intestinal blood flow decreases because of poor perfusion and so it reduces the viability. So in such sick patients, which drug route is preferred? IV administration, that is intravenous drug is preferred. P-glycoprotein, it decreases bioavailability by drug efflux from enterocytes. So what P-glycoprotein does? It decreases the bioavailability by drug efflux from enterocytes. And diseases of liver for reduces first pass metabolism and increases the bioavailability. So first pass metabolism कहाँ पर हो रहा है? It is happening in liver. And when liver is not functioning well, then the first pass metabolism decreases and hence it increases the bioavailability. So this is like a cycle. Suppose this is drug is getting first pass metabolism and this first pass metabolism is occurring in liver. Now suppose this liver is not functioning, so first pass metabolism is decreasing and this drug breakdown or changing of this drug into another compound is decreasing and hence drug concentration is or bioavailability is increasing. So this is concept behind this. Now next point, disease of intestine can reduce drug absorption and bioavailability. We've already seen disease of liver and drug intestine. It reduces absorption and bioavailability. Disease of intestine, disease of liver will increase bioavailability, while disease of intestine will reduce the drug absorption and hence it increases or decreases the bioavailability. Okay, because of poor intestine blood flow, as we have seen in previous statement. Now, what is bioequivalence studies? Bioequivalence studies compare bioavailability of two formulations. Area under the curve is the measure of extent of bioavailability. So, area under the curve is the measure of extent of bioavailability. So, how the bioavailability is measured? It is measured as area under the curve. Thank you for listening. You can subscribe this channel for more upcoming videos. Thank you very much.